All right, everyone, we are entering week 6, and that is going to be unit 3 in population health nursing strategies. Here is your assignments for the week. I need you to go into your Clark book and read chapters 11, 12, 13. You're going to do your ATI community text, which is chapter 5, and you're going to do the Engage Community Public Health modules, health education, emergency preparedness, and management. There is a discussion forum where you are going to create a response by Wednesday and then respond to your peers by Sunday. There is a concept map on epidemiology. You have quizzes for each chapter, and then you have your ATI Swift River clinical simulation. There are your assignments. They are due by Sunday at 23:59. What is happening between the classes, and I do speak with the other instructors, is that people are making up excuses to try to get extensions. One of which was somebody whose power went out, and they emailed the instructors at 9 p.m. But they had about 7 or 8 hours worth of work in both classes to complete in a 3-hour period, which is impossible. You cannot wait until Sunday night to do your work. You should be breaking up each class and saying, okay, on Monday, I'm going to read chapters 11, 12, 13. And then on Tuesday, I'm going to do my ATI. And then on Wednesday, I'm going to do my discussion forum. And then on Thursday, I'll do a peer response and my concept map. Friday, I'll do my quizzes. And then Saturday and Sunday, I will wrap everything up. Break apart your classes. I understand you guys have a lot of classes and there's a lot of work, but so is nursing. So you need to start engaging in methods to get your work done and to have time management skills, because you are going to need this when you have 8 patients on the unit as an RN. All right, so moving on, let's look at if my computer will decide to want to participate. Okay, let's look at this week. All right, so chapter 11, your population and community health nursing, health promotion, and health strategies. All right, this chapter is going to talk about what is health promotion. You are going to distinguish health promotion from health education. You're going to apply those selected models for health promotion practice, analyze implications of health literacy, describe the health education process. We're going to talk about social marketing, branding, and tailoring of promoting health, and designing and implementing a health education program. So trends in health promotion. All right, we got defining what health promotion is. What are the definitions that exist? Your book will go over the Ottawa Charter for Health, the Bangkok Charter for Health, the Jakarta Declaration of Leading Health Promotion in the 21st Century. Health promotion efforts in the United States continue to focus on behavior modification and prevention of specific health conditions. We talk about a horizontal versus vertical health promotion. Make sure that you understand the difference, that one is focusing on behavior modification and one is changing broader factors. Right, so what other trends in population do we have? We have sanitation, right? Not that long ago, we did not have sanitation and people got very sick because there was human excrement and garbage all over the streets. We have immunization programs. We have risk modification programs. We have recognition of the effects of social conditions on health. The U.S. healthcare system is overwhelmed by the demand for chronic disease. The system cannot continue to meet those needs, so we must do something to motivate American people to promote and protect their own health and change the conditions in which we can live and foster better health. A large part of being a nurse is health education. You don't just go in and take vital signs and listen to heart and lung sounds and then chart and then go to lunch and then go about your day. You were going to be in there. You're going to be telling your patients what you were doing, why you were doing it. Why are we doing an ultrasound? Why are we giving you an ACE inhibitor? Why are we giving you a beta blocker? Why are we giving you a diuretic? Like, we are going to be educating our patients all the time. And when we see their family members bring in a big thing of McDonald's or Chick-fil-A, we are going to go back in there and we're going to educate the fact that what salt does to the body, what fat does to the body, you know, especially our diabetic patients. We don't want them to lose their toes. We also don't want them to suffer from erectile dysfunction. So we are always educating. Table 11.1 goes over the errors of public health practice and related focus. We have from the ancient times until the 1800s, and then all the way down to the 1990s to the present. Defining health promotion, a process of enabling people to increase control over and improve their health. It involves public policy formation, development of environments that support health, and promotion of community action. This is why politics plays a huge role in healthcare, and why members of your state legislator and members of Congress need to be reaching out to health professionals and having health professionals on as part of their staffers, because they can't be making legislation changes without talking to the people who know best. So involving changes in social, political, economic, physical environments conducive to health. We're looking at the Steps to a Healthier United States initiative, promoting behavior change, improving policy and environmental conditions, reducing the burden of 5 specific conditions. And these are the ones that cost insurers and hospitals the most money right now: asthma, cancer, diabetes, heart disease, stroke, and obesity. Some of these are preventable. Some of these we can fix and reverse. Some are non-modifiable factors. Focusing on personal behavior modification, addressing the policies that influence the health. The need for health promotion, overwhelming demand for care. We need for people to promote and protect their own health. There's some highlights from your book going over the different needs for health promotion. In 2010, 17.3% of the United States population was smoking. We've since lowered that, but now we're seeing an increase in the vaping and an increase in lung damage. In 2013, 13% of the United States population did not use seatbelts. We have a need for health promotion. In 2010, the median of 15.1% of the United States population engaged in binge drinking, and 5% reported heavy drinking. And then a lot of those people also got behind the wheel of a car and drove under the influence. The median prevalence of overweight across the United States in 2010 was 36.2%. That number has astronomically went up since 2010. The median prevalence of obesity was 28.5%. That number also has skyrocketed. Models for health promotion. There are a bunch of different health models that are in your book that you can read about, and the different theories. Precaution adoption process model is a stages and decision to adopt or not adopt a health-related behavior. And it goes over the different stages. There are 7. You can read those in your book. Theories of reasoned action and planned behavior was a theory that was developed by Azzen and Fishbein, and it's based on 2 types of beliefs: a behavioral belief that reflects a person's attitude toward an expected consequence, and a normative belief that relates to subjective norms influenced by others. We have the integrative model of predicative action. Expands elements influencing intention and subsequent action to include background influences like your individual characteristics, your culture, your emotions, and other interventions. Health belief model was developed by Becker, Rosenstock, and their colleagues. Elements of that model is individual perceptions of susceptibility and modifying factors, perceptions of benefits and barriers, they're cues to action. And Pender's health promotion model is a behavior is influenced by individual characteristics and behavior-specific cognitions that can cause a commitment to action. Stages is indecisions to adopt or not adopt a health-related behavior. All the different stages are here. I believe there are 7. There are 7. Okay. It goes over where you're unaware, you're unengaged, you start deciding, you decide not to act, or you decide to act, and then you have your action, and then you have your maintenance. And then there's all of the different health belief models. Okay, we just talked about all these, so you can read these on your own. The PowerPoint is there for you. All right, readiness for change. Trans theoretical model of change occurs in stages. We have, there's a lot of, I've seen a lot of test questions about these, looking at pre-contemplation, meaning you're not even thinking about or aware of the fact that you need to make a change. And you have that contemplation phase, which considers change to take action within the next 6 months. We have a readiness for change that occurs, preparation, action, maintenance. And that actually applies a lot also in psych nursing, where a person is not going to make change until they are in that contemplation phase. A person in addiction is not going to make change until they are in that contemplation mode. 12% of the United States population, 52% and 22%, looking at the different levels. All right, so 77 million people in the United States display basic or below basic levels of literacy. When you speak to patients, just assume that their highest level of education is 8th grade, because 90% of US adults have difficulty understanding routine health information. You can't go in the room and use big fancy terms. You have to break it down to their level. Break it down to how you are feeling right now, reading the things in your nursing books where you're like, oh my God, I do not know what this even means, what this word is. How you're feeling right now, that's how your patients feel. So remember this, because that is how you will approach them when you are doing your health education. And we always do our domains of health learning. So when you go in, you ask the patients, how do you learn best? Is it through written material? Is it through oral like us having a conversation? Some people are auditory learners. Some people are visual learners. Right, social marketing, phases of the social marketing. And of course, my neighbor decides to start weed whacking right as I was trying to record this. All right, well, we're almost done anyway. Phases in social marketing, planning strategies, implementation. Where have you heard those words before? Nursing process. All right, we have a problem description, market research, strategy, intervention, monitoring, and implementation. Okay, legislation. You can read those on your own. A community health worker's role and what they are doing between the community and the members of the healthcare team. Community health and public health nurses are very important. I mean, we saw their presence during the COVID, during Ebola, during swine flu, you know, what are there other diseases that have emerged since you guys were born? Levels of evaluation. Let's blow through here. You can read these all on your own. All right, and pretty much that was chapter 11 in a nutshell. Read over your community health workers, your legislation, how we alert lawmakers to the need for legislation in a particular area, how we campaign and educate the public about these efforts. All important and most likely questions you might see again on your quiz. All right, let's stop the share here. I always have this one little piece of hair that likes to fly around. All right, you guys have a great day and good luck on your quiz.